Welcome back. Well, you've heard of knee and hip replacement surgery, but what about knee or hip revision surgery?
And joining us now is Dr. Brett Freiberg. He is part of the Jacksonville Orthopaedic Institute. We just went over that, Freiberg. Welcome back. It's good to see you again. And on top of it, you've been here before. So first of all, let's talk about revision surgery, what that is, because when people are thinking about having surgery for their joints, they don't hear revision surgery. What is that?
Right, so people usually don't like to talk about it or don't like to think about it, because what happens when all these joints that we're putting in wear out? What happens, God forbid, if something goes wrong? And people moving in from out of town, or people that had their joints done in the 80s, 90s, and even early 2000s, they're starting to come back in with the joint wearing out.
And they have to think about, am I going to have to go through surgery again?
Right, it's a very scary thought, but surgery back then and surgery now are quite different.
Yeah, it's changed quite a bit. Technology has made it probably a lot simpler, quicker, and better for the patient too, right?
Very true. Very true.
So revision, though, so they've had one, and revision, are you pulling? What does this mean? Are you pulling the old joint out, putting a new one in?
Pulling, that kind of, I don't know if I'd use that word.
Have you ever seen the surgery
No.
when they're doing knee?
No,
my buddies at orthopedic sales, and they use like hammers, slamming some of this.
Yeah, not telling me real well right now, but no, it can mean anything from, I call it changing the tires or changing the components that can be changed.
Yeah.
Versus having to take everything out and kind of rebuild and reconstruct either their pelvis or their knee or any part in their hip. But it's very, very complex surgeries that not a lot of people do, and something I have a true passion for.
So who would be coming to see you for something like this? Somebody who had, like you said, a surgery long ago, 80s, 90s, what have you, and they feel like something isn't right, they can come and they would be a good candidate?
Yeah, they'd be a good candidate to at least get checked out. And I have people coming in 3 months after a surgery's been done and said something doesn't feel right, and just to at least get checked out, and even just to ensure that everything was done right, but I'm still having discomfort, versus the person that's had it in 25 years and has no pain but hasn't seen a doctor in a while. So they'll come in too. But it's for us, it's like playing detective. Why is something hurting? Why is it wrong? What can we do to help this person?
Right, and at the end of the day, it's getting rid of the pain.
Exactly.
Right.
So you're seeing some patients come in because they are having pain or an issue with the hip or the joint, but others out there who may have one that aren't having any issues, you think they should just come in and you're checking them out and doing kind of like a consultation for them as well?
True, yeah. And so if someone's had a joint in more than 10 years or so and they haven't checked in with their doctor in a while, or their doctor's no longer practicing, or they moved from out of town, we're happy to see you and at least ensure you that you're doing well and give you a timeline on your joint's doing fine. Hopefully you're still staying active, and people are so worried about it, then they don't go to doctors, and then it's...
That was going to be my next question. It's like you have the pain, but you want to endure the pain because you're afraid if you go in, it's going to mean surgery, even though surgery could get rid of the pain entirely. But what would you say to those people who are just kind of tolerating it because they're fearful of what could be down the road?
No, it's a really good question, and I think that you shouldn't be afraid to go in and get it checked out, because most of the time they don't need surgery. Most of the time it's just reassurance to the patient, like, hey, it's okay to stay active. You've got plenty of time on this. We do joints so people stay active, and if you're holding back because you're afraid that maybe the pain in your hip or knee is going to require surgery, then I think that defeats the purpose.
And I'm sure there's many levels, right, that you go through, and other treatments that are non-invasive that you could get and go through before you would get to the point of needing surgery.
Yeah, that's exactly right.
Yeah.
You've been doing this a while, so the thing that I'm intrigued by always is the technology advancements. Like, from when you started getting into this field compared to now, just the ease of the surgeries, the recovery of the patients. Talk a little bit about the time difference, where it used to be a much longer recovery, and now it seems in a day or so they're walking again.
Right, and that's true for both the primaries and for revision surgeries. But computers have made it great. Pain relief and pain medicines and protocols at the hospital have made it great, but it's a 1 or 2 day stay in the hospital. Now, granted, a big pelvic reconstruction gets rid of a lot of the pain the patient's been having, but it's something that's 3 or 4 days in the hospital and may need rehab. So there's but it used to be 4 weeks,
right.
3 weeks in the hospital and then rehab. So times have changed dramatically. And all those patients that come in that have had it done in the 80s and 90s, and they're said, 1 or 2 days, there's something different, no, it's just times have changed, technology's gotten better, implants have gotten better.
Able to help more people.
Oh yeah.
Good to see you.
That's awesome.
Dr. Freiberg, appreciate you being here, as always, and for joining us.
Thanks for joining us. We want to thank Jacksonville Orthopaedic Institute for making this segment possible. For more information, you can log on to their website, which is joi.net. You can also call their mainline number at 904-JOI-2000.